at the hospital's emergency department. The UL Hospital Group said the measures were being put in place because of the unprecedented number of people attending the ED, driven by a surge in respiratory infections, including COVID-19, flu and RSV. Well, our reporter Laura Hogan has more on this and joins us in studio now. Laura, we know that there's been many hospitals saying that they're having a surge in infections and hospitalisations because of these respiratory infections. This hospital, though, taking certain measures as a consequence.
That's right, Karen. So this major incident essentially means that UHL is under severe pressure due to the sheer volume of patients that are coming through the doors of the ED there. And to deal with this, UHL says it has taken a number of steps, including asking extra staff to present at the hospital to work and also redeploying some staff from other areas into the ED to care for patients there. Now, the knock-on effect of all this is that all outpatient appointments at UHL have been cancelled for tomorrow, and only urgent elective surgeries will be taking place there over the coming days. Visiting restrictions have also been put in place there due to a large number of patients with flu and COVID and a number of outbreaks. But just in the last few minutes, UHL has confirmed that for a number of hours earlier today, some non-critical patients being transported by the National Ambulance Service were temporarily diverted away from UHL to other acute hospitals. Those patients were brought to the closest alternative appropriate hospital, and the most critically ill patients, the hospital says, for example, those with suspected heart attack and stroke and those who are medically unstable, they are continuing to be brought to UHL during that time. Now, UHL say that for patients with less urgent conditions, they have faced exceptionally long waiting times, and they've asked people who are those less urgent cases to consider their other options like GP services or injury clinics before they present to EDs. And a similar plea from the Mater Hospital in Dublin was made earlier today. That hospital saying they're under extreme pressure, but saying that patients who do require emergency care should attend the ED and they will be seen.
Laura, thanks for that update.